Jana.
Our PowerPoint is on neuroblastoma.
So, a neuroblastoma is a malignant tumor that originates in very early nerve cells located in an embryo or fetus. So most people haven't even heard of neuroblastoma, but it's actually the most common cancer in infants. Neuroblasts are cells that turn into nerve cells. So before they're a nerve cell, they're a neuroblast. And how the neuroblastoma forms is those cells, when they're going into the transformation, instead of turning into a nerve cell, they turn into cancer cells, which then do not function properly and continue growing as cancer into the tumor. This is where we can then visualize on more than just a cell level the pathology, because it's growing into the tumor. This type of cancer is most common in infants and young children. More than 90% are adrenal in origin. The adrenal gland is the triangular organ on top of the kidneys. And most people just think of it with the fight or flight sense, but it actually controls your breathing and your heart rate as well. Nearly 90% of cases are diagnosed by 5. It is the most common cancer in infants under the age of 1, and it is the most common abdominal tumor in infants and children.
And the type we are talking about is just adrenal in origin. I wanted to make sure you knew that before we went through the whole PowerPoint, because there's multiple different other types. Here's some neuroblastoma statistics. It is the leading cause of cancer death in children under the age of 5. It's the most common solid tumor in the children under the age of 5, and children who survive have a high chance of developing the long-term effects because of the chemo and radiation they have to go for the treatment for this cancer. And only 1 out of 2 kids that are diagnosed will survive. And it's often, the treatment for this is often very invasive and painful, and it includes multiple of these things I'm going to talk about further on in the PowerPoint, but it includes surgery, stem cell harvest, radiation, bone marrow transplants, immunotherapy, and multiple rounds of chemotherapy.
So, cancer, like neuroblastoma, like any cancer, is going to metastasize to anything that it comes in contact with. It can possibly metastasize to the lymph nodes, bone marrow, liver, bones, skin. The spinal cord compression can cause pain and sometimes paralysis. The tumor secretions that irritate other normal tissues. These chemicals may cause rapid eye movement and hypercoordination, and they may also cause abdominal swelling and diarrhea.
So, who's at risk for neuroblastoma? It occurs typically in the ages between 2 months to 2 years, and patients with a family history of neuroblastoma have a higher risk for developing this type of cancer, but it's not always associated. They say it's actually rarely associated with the family history. Neuroblastoma tumors have also been associated with patients missing chromosomes 1p and 11q. I had never heard of this, but these chromosomes are thought to prevent tumor growth, so missing them could go towards that.
So there's a wide range of signs and symptoms that come with neuroblastoma. It really just depends on the staging. Abdominal mass would result in pain there, depending on where the pressure is going. If the tumor is exerting any kind of pressure there on the abdomen, they can experience pain. It can be palpable, but not sensitive to touch. They can have changes in stool, which would be diarrhea or constipation. They can have darkness around the eyes, back pain, and bone pain. All of those are associated with if it's metastasized to the spine. And then fever and weight loss. So, of course, all of these symptoms would leave you in an unwell state of being, so probably wouldn't want to do that much.
Okay, so here's some important lab values that are associated with a neuroblastoma tumor. Complete blood cell counts are indicative of anemia and thrombocytopenia in the children. Urine and blood tests are often used to check for the high levels of certain chemicals. These chemicals that are present in the urine are hemovanillic acid and vanillyl nucleic acid. I think I said that right. But they're checking for the presence of those two types of acid in the urine. 90% of these neuroblastomas secrete those byproducts. And additional lab tests may be ordered to evaluate liver and kidney function in children with this type of tumor.
So the lab values are good to correlate with the clinical findings. So if we have a lab value that is showing it's elevated, and then also we have the clinical findings with the signs and symptoms, next we may want to do some additional testing. So biopsy would be one. That's where the physician removes tissue from the tumor to determine if it contains cancer cells. It can be guided by CT or ultrasound. Ultrasound, of course, is normally the go-to when it comes to children because there's less radiation. Bone marrow aspiration, which is where the neuroblastoma commonly spreads to the bone marrow. The bone marrow tests are used after diagnosis of the neuroblastoma to determine the extent of the disease. A small piece of bone and marrow are withdrawn with a large needle that is inserted into the back of the hip and bones.
And this right here is an image because I think a lot of people don't realize what a bone marrow aspiration is. And it's actually when they go into the hip bone with a large needle, and it's very painful for anybody, but especially children. And it shows here in this image where it goes through the bone, the cortical bone, and then into the bone marrow to the spongy bone where they get those tissues to help diagnose and see how far the cancer has spread.
So there's different stagings here. Of course, we're going to begin with the less severe and go to the more invasive, but staging is used to determine the extent of the cancer and whether it is spread to other organs. Stage 1 is where it's just a localized tumor and it can be removed completely with surgery. Stage 2 is a localized tumor, but it's not easily removed. Stage 2B, first one was 2A, is the localized tumor that has spread to the lymph nodes. Stage 3 is advanced neuroblastoma. It cannot be removed through surgery and may become large. This is where you would start seeing the abdominal pain, the back pain, the bone pain, because it's pressing on other organs and structures there. Stage 4 is advanced stage with metastasized to other organs, and stage 5.
It's
5S, I don't know
It's
why.
4S actually, it's stage 4 and then
Okay.
stage 4S.
4S is special. S is special category that only applies to children under 1 year old. There's a good chance of recovery and usually requires no treatment then.
I thought that was interesting because you would think with it being stage 4 and it has spread that it would be harder to treat, but it's a special category where it typically will resolve on its own, and it's usually seen under the age of 1. Right here is a staging map I've seen. I thought it was very neat. It shows where the stage 1 has just spread on the adrenal gland, so it's usually surgically removed, and then the 2A, it's kind of grown a little bit, and same with the 2B, and then you can start seeing in stage 3 where it's spreading to other organs, and then into stage 4 where it's actually in the bones and in the lymph nodes, and also spread to like the liver and the spleen, and then stage 4S as well. And it also shows on here neuroblastoma stage 4 can metastasize to the lymph nodes, the skin, the liver, bones, and bone marrow.
So what is our role with ultrasound here? As 4S, it's a better recovery there if it's found earlier with the infants. So in ultrasound, we start looking at these babies when they're in utero. So if we can find it while they're still in there, it's a lot easier when they come out to find preventative care. And sometimes it can be removed. This would be amazing if that happens with all cases, but sometimes it's not big enough, because again, it's starting as just a small cell. It's a nerve cell that's went wrong and is growing. So if that growth isn't large enough to see in utero, you're not going to find it yet until they're a little bit older. With infants, ultrasound is the safest option in determining, is the suspicious area cancerous, has the cancer metastasized, determine the best treatment options. Keeping updated images and knowing the size, shape, and origin of the cancer from staging, treatment, and prognosis is going to be the best. Children with neuroblastoma will have to endure multiple imaging tests. Because these tumors typically arise with a very young age, imaging can often be very difficult. Sometimes they don't want to stay still, maybe, they're already sick, and you just have to have patience with that.
So here's some different imaging modalities for neuroblastoma tumors. X-ray is one of them. Ultrasound is most commonly used to evaluate tumors in the abdomen because it is efficient and it doesn't require more radiation towards the child. Computerized tomography, or CT, is a detailed cross-section image that can detect the abnormalities in tumors. MRI is often used to measure the size of the tumor. Contrast mediums are used when you're doing an MRI to create a clear image. And there's the MIBG scan. It's neuroblastoma cells. They absorb this type of protein, so it shows up on the MIBG scan where you can actually see in the bone to see if it's spread to the bone marrow, and other parts of the body. And then a PET scanner are often used for a small amount of radioactive substance that's injected into the patient's body, and it produces images of organs that produce a high amount of energy and detect tumors. Because these tumors do detect such a high amount of energy, it shows up really well on PET scan. And then here is this is a CT of one, and then we have an ultrasound. And this is the MIBG scan here, and you can see where it's spread to the organs. You can also see it in the bones as well.
So this is going to describe the sonographic appearance that we would see a neuroblastoma. It's going to be a heterogeneous mass. It has internal vascularity because, of course, it's a cancer, so it's getting a lot of blood flow there to grow. There's area of necrosis that appear hypoechoic, so it's killed off some of the good tissues there. The calcifications may be seen. There's cystic areas, and the possibility of nets in the liver, aorta, celiac, and superior mesenteric artery could be visible as well.
And you can see on that image where the mass is very heterogeneous. And it can also, if it's large enough, it can displace the kidney as well. Treatment options for neuroblastoma, there's surgery that's typically used to remove the tumor, and then it's also used in combination with chemotherapy, where the use of chemicals destroy cancer cells and shrink the size of the tumor. Radiation therapy is the use of high energy beams to destroy cancer cells. This is also typically used in combination with chemotherapy, radiation, and surgery. And it's commonly used after chemotherapy to prevent the cancer from occurring. And oftentimes, like I said, these types of chemotherapy and radiation therapy can cause even more problems later in life for these kids who they have to go through so much already. And a stem cell transplant is collected stem cells that are injected back into their body to form healthy blood cells. And then there's also immune therapy, where drugs are administered to signal the child's immune system to help fight these cancer cells.
So the patient outcomes with neuroblastomas are more likely to be cured in younger children than ages 12 to 18 months. Again, this is because of the size. It's been growing this whole time. It could have metastasized to another region in the body. The survival rates, according to the American Cancer Society, is a low risk group, 5-year survival rate above 95%. Intermediate risk group is a 5-year survival rate around 90 to 95%, and a high risk group would be a 5-year survival rate is approximately 40 to 50%.
Any questions?